So the posterior aspect of the thigh, we have the gluteal region and the hamstring region. So if we just look at the gluteal region, the large gluteal muscle is gluteus maximus. And it starts, it's hard to tell, but it starts here in the midline of the body on the sacrum and the coccyx. And a portion of it starts here on the iliac crest. The muscle fibers then converge over, and some of the fibers go to the iliotibial band, or IT band, or tract, however you want to call it. And part of the other fibers underneath go to the gluteal tuberosity. If you take off gluteus maximus, just deep to gluteus maximus, you can see gluteus medius. So it starts on the external surface of the ilium, just below the iliac crest. Okay? And this one goes over and it inserts onto the greater trochanter of the femur. You can't see gluteus minimus on this particular model because we can't take it off. Also attaching into the iliotibial tract, or band, is TFL, tensor fascia latae. Okay, this muscle is located on the opposite side to gluteus maximus. So that means that it's going to have the opposite function at the hip joint. Gluteus maximus does extension of the hip, whereas tensor fascia latae does flexion of the hip. In the deep layer of the gluteal region, we have our lateral rotators. And these muscles are really small, and they all laterally rotate our hip joint. One really important one is this one here that's kind of triangular in shape. It actually starts on the anterior surface of the sacrum and goes underneath this ligament here to go over and insert around the greater trochanter. This muscle is called piriformis, and it can be used as a landmark in the gluteal region because just coming out inferior to it is the sciatic nerve. Okay, so often I'll look for the sciatic nerve and follow it superiorly, and wherever it stops is piriformis. Most people it comes out below. So below piriformis, we have the superior gemellus muscle. Then we have obturator internus, inferior gemellus. These three work together to do lateral rotation of the hip joint and also to stabilize the hip. And also one last lateral rotator, which is quadratus femoris. It has four sides, so quadratus, and it's attached to our femur. One last lateral rotator, which you can't see on this picture, or on this model, is obturator externus. And in our textbook, it doesn't group it with the lateral rotators. So we can't see it anyway, but another one that's not included here is obturator internus.